And thank you for joining us. With us is Dr. James Mancini. He's Director of Dental Services for Meadville and Valley Dental Centers. Doc, thanks for being here.
Thank you.
Tell us about yourself.
I'm a dentist. I've been a practicing dentist since 1986. Graduated from University of Pittsburgh. I've been working in the field obviously for a long time. My staff wants to know if I worked on dinosaurs. I haven't, but I just missed them. Anyway, I'm the director here. I came here in 2020. Prior to that, I was the director for the Salvation Army Dental Centers in Venango County and Cambria County. And prior to that, I was in private practice.
What age did you know this is what you wanted to get into?
50.
What, really?
Yeah, I can't give a reason, but I just remember when on my 50th birthday saying to my wife, I need to do more in our profession, and private practice wasn't it. And so I started looking around for positions in public health, which is public dental health, which is what we do here. And I started that, like I said, almost 15 years ago.
You mentioned Salvation Army. Just to kind of get into that for a moment, obviously there's a need with youth, and school districts are saying we have issues with students, and just the level of health care for, in terms of the dental aspect, for our youth who might not have access to dental care. This is a big conversation, a big topic.
Oh yeah, in our office in Oil City, we actually had an agreement with the Oil City High School where we actually put 2 dental chairs in their school, and we would regularly go up to the school and treat kids at the school. It's easy because obviously a 14-year-old or a 13-year-old can't drive, but he's at school, so rather than waiting for that child who might need help with something to come to us, we would go to them. And we would treat them at the school. It was a very, very successful program for us because, again, the parents appreciated it because a lot of parents, either couldn't take time off or didn't have the time to take off to bring their kids in, so we could see them there. And the school district enjoyed it because all of their children are being seen. And so we were actually one of the first to do that in this area, to have a center like that. It was very, very successul.
And what does that mean for the student when they're getting taken care of like that?
Well, in our country, 51 million days are missed every year by students for dental problems. So it's a giant number. Next to asthma, dentistry is the #1 reason why kids miss school. They have dental pain, they have dental problems, and they just can't go to school. They're in pain. So for children, it's a massive problem, and we're obviously trying to address it. We at the dental center work with the Head Start programs. So the Head Start programs in Venango, Crawford, and Erie County has 2,000 children. And we go to their centers every Wednesday, all fall long, to see every one of those kids, to get ahead of it, because these are kids between the ages of 3 and 5. So we try to get ahead of the problem by seeing these kids young, so if they have any problems, we can address those problems now, as opposed to waiting until they're in 3rd or 4th grade and then they're in pain. So that's one of the ways that we do that. So we're trying to address that issue, even now. That's
incredible. So let's kind of go back just a couple of years. You come to Meadville Medical Center. What made you say this is the place that I want to be?
So working in public health, you kind of know all the other public health places. There's not a lot of us, and I've always loved this place. And I've always had patients come and say how great it was, and we referred patients here. And quite frankly, it was during COVID, and I just happened to see they put an ad out, and I thought, I've always wanted to be there. So I filled out an application, and they dragged me in 3 days later.
That's incredible. And just so people kind of get a bigger picture of all this, you're not just driving a couple miles to come to work. You've got quite a haul.
I drive 92 miles each way. I live in Pittsburgh. I live on the western side of Pittsburgh, so I actually live right near Interstate 79. So I just drive down the road, get on 79, and drive up here. the end of today, I will drive back home. I do this 4 days a week.
What's changed in dentistry since the time you started to now?
So one of the biggest things that's changed for us, and specifically for our office, since COVID, Pennsylvania's lost 2,000 dentists. Okay, so 2,000 dentists from 2019 until 2021 left either the state or the profession for whatever reason. I don't know that. But because of that, there are less dentists. And so rural practices like ours are really particularly hit hard. There's not enough providers. So our office really is an island, especially in the world of public health. We're really on an island. And so we have a lot of patients. We have a lot of patients coming to us from not just Crawford County, but they come from Venango, they come from Warren, they come from Erie, they come from Mercer, they come from Clarion. We have people that drive over an hour just to come see us. And we know that, we realize it. We're obviously making a huge effort to try to help that situation. Just on Tuesday, we had the unveiling of the building up at Alden Street, where our office, we added another treatment room. So we now have 9 treatment rooms. And so we're trying to be able to get more people in the door. We see on average 1,000 patients a month, which is a lot. There's a lot of patients. 12,000 a year. If that office was bigger, if there was more staff, I could double that. It's just that we are really out here on an island by ourselves. So the biggest change in my profession is the lack of providers because of what happened during COVID.
That's incredible. Talk about the various things that will bring somebody to the dentist. Obviously, it'd be nice if you heard, okay, it's a 6-month checkup.
Right.
That's great. What are some other things that people are coming in to see you?
So when we talked earlier about children, obviously one of the things that kids, what we push is, we call age 1 dental visits. We want kids to come in, we want parents to bring their kids in before their first tooth comes in. Not because we're gonna do anything, but because it starts the process of familiarity for the patient, for that child. So we push that, we want them to come in. Please bring your kids in, the old adage that we don't see kids before 5, that was ancient history. We want them to come in as early as possible. We say hi, we talk to the parent about oral care, and then we keep bringing them back. Next time they come in, they might have 4 teeth. The next time they come in, they might have 10. But by the time they're 3, 4, 5 years old, coming to the dentist is nothing. It's easy. It's normal, and that's a good thing. Kids need, all ages of school. Kids need dental exams for no other reason than dental exams are mandated by the state of Pennsylvania for kindergarten, 3rd grade, and 7th grade. So they have to have forms filled out, and they come in for that. So kids are coming in, because obviously, we want to get them on the right track. Adults are coming in for a variety of reasons. We last year, I don't know why this didn't exist prior to this, but last year when we made an agreement with the ER gets patients in all the time, and they didn't know where to send them. I'm like right up the street, so bring them in. So now what happens if the patient would go to the ER contacts our office, and then we set up a visit for them to get in right away so that they don't become a repeat emergency room patient, because we need to deal with why they're there. And so we started that program, and that's been incredibly successful. We have patients every week, and also it takes patients away from the ER. They have all their patients too. I don't need to be piling on for that. Everyone's coming in for treatment, obviously comprehensive treatment. People are in pain, and we're trying to get them out of pain. So we're dealing with, with a lot of different situations. And then, just like you said, once we get them back to where they belong, they come in regularly every 6 months, get them cleaned, make sure everything's okay, and then off they go.
I think sometimes people kind of forget that it's more than just teeth. The oral health plays a role in a lot of things. Maybe kind of dive into some of that.
So medical-dental collaboration is a passion of mine. When you're in dental school, that collaboration is really stressed. But for the longest time in my profession, once we graduated, we sort of went on our own. We were lone wolves. We did our dentistry, but that was all we were doing. And that's now coming back around to get back into the collaboration with medicine in certain things, and you'll see this all the time. Patients who have had a knee replacement, they have to have dental exams prior to their knee replacement, because if there's something that needs to be addressed before their surgery, they want that addressed before surgery. Patients that are, at the Barco Center, same thing. They're having treatments over there for whatever condition that they have. They also need to have dental clearances. So we do a lot of that. OB, we do a lot in OB patients. Pregnant women. It's a big thing. There's a very high incidence of like gum problems with obstetric patients, and so just come in and get a simple cleaning, and that's all it is. Diabetics are a huge problem because dental issues, especially periodontal disease, can make their diabetes worse, and so we have to stay on top of that. That's dental medical collaboration, and one of the reasons why I love it here is because of that, because this hospital believes in that. They send me patients all the time. I talk to all the different departments. It's great.
Kind of just run through maybe those things that people should come in and see. Maybe the things that you might not think about. Obviously, if you're experiencing pain,
right,
that's probably an indication. But what are some other things that may pop up that somebody might kind of brush off, but should schedule an appointment to come in and see?
Sure. Really, we want everybody to really. I made this joke the other day at the at the ribbon cutting, was that the dental department, of course, is the best department in hospital, and I can prove that because people come to me twice a year and they only go to their physician once. The reason we say that is because if we can stand on top of what is going on, I can fix little things a lot easier than I can fix big things. So if you say, well, I'm going to go in only when it hurts, you're making a huge mistake, because if you keep getting constant abscesses, getting back to medical dental collaboration, you start coming up with things like lung infections and digestive problems from bacteria, and we want to eliminate that. We want to get ahead of that, which is why we want people to come in regularly so we can see that before it becomes a problem. It's a lot easier to treat if I can get it before it becomes a bigger problem. Because once it becomes a bigger problem and I have to do some of the heavy lifting that's in my profession, nobody likes that. Nobody wants to be part of that. And I get it. And that's why I kind of nag everybody, come back to see me. Come see me before this happens. And luckily for us, it's been working. People have been coming in. Obviously, we're seeing 1,000 patients a month.
Well, so another aspect to it, I would imagine, is also the confidence of somebody who has a healthy smile, somebody who can just go out in the world and smile.
Absolutely, because that's a big thing, is just the aesthetics alone. If you look at somebody's smile, it tells a lot about them. And you're going for a job interview, you're going for some other event, and your teeth are the first thing that people are going to notice. And so again, if I can stay on top of what's going on, we won't have a problem. You won't have, that will be one of the least things you have to worry about. For instance, if you're going on a job interview, right? This should be the least thing you have to worry about. All the other stuff, fine, but not this.
Give us some quick tips. What are things? It's funny. I think about things that I was told as a kid, and then things that our dentist told our kids. And, things change a little bit over the years. There's some things that have been consistent, but kind of just refresh everybody on those things. The number of times you should be brushing a day, flossing, all this stuff.
Brush and floss twice a day. The one that people forget about a lot is simple hydration. Drink water. Your teeth, your oral cavity, it's the first place that gets affected by dehydration. And so when that happens, then bacteria is able to flourish and causes all kinds of problems. So a simple, glass of water several times a day is huge for your oral health. People that take medications, sometimes medications cause dry mouth. There's 400 or 500 different medications that we all take, that we take normally, that actually lead to dry mouth. So again, hydration is a big thing. Yes, brushing, flossing, absolutely. Come into the dentist is huge. Those are easy things to do. I know I'm a big scary person, but really, come in. We'll take care of you. And again, if we can do all these little things, then one of the jokes in my profession is we're one of the only professions that literally works to put themselves out of business. If everybody does all those things, I won't have anything to do. That's not a bad thing.
Just so people know, we had a great conversation prior to this, and he is a wonderful guy. He's got a lot of personalities. So I want to just ask you, because you mentioned the number of patients you're seeing. Is there room for somebody to call and schedule an appointment?
Yes. Yes, there is. Absolutely. We want you to call and schedule an appointment. We'll get you in. If it's an emergency, we can get people in. It may not be that day, but it won't be that long. Patients that just coming in for cleanings, okay, it might be 6 or 7 months for just a simple cleaning, but that's only because people are scheduling their 6 months.
Yeah.
So that's actually
once you
a
get
good
into
thing.
the
But
system,
once you get into the system, you're in the system. So then that's good. Then you're a repeat customer after that. So absolutely, both offices, both Valley and Meadville, please call.
And if somebody has a question on whether you take this insurance or that insurance, they can call the office
Yes.
and have that conversation with them.
And we take almost all insurances. There's very few we don't take.
Congratulations on the growth, first of all. Does that mean there's job or career opportunities with
Sure.
your office?
Sure, because we're still we're looking for hygienists. We look for what are called expanded function dental assistant. It's called an EFTA. We're absolutely looking for them. The chairs, the chair's empty. That's actually sad if one of our chairs is empty, because we could have had people in there. But in order for that chair to be full, there has to be somebody sitting there doing the work. So yes, we definitely need all auxiliaries. And again, part of the problem is, just like I said about the dentists, after COVID, we lost a lot of assistants. We lost a lot of hygienists. So we're kind of just building that back up, now, and it takes some time.
Call, schedule an appointment. Doc, before we wrap up with you, you have that drive here and drive home, so you get a lot of time to think.
Absolutely.
What are some things you enjoy either listening to in the car, or what do you do to relax and unwind?
I'm a big classic rock fan. We listen to classic rock in the office. Actually, patients come up compliment us on our music choices. So, although I will say my assistant does make me listen to Taylor Swift on Wednesdays. We have Taylor Swift Wednesdays. Just want to point out, in case there are any Swifties out there and you want to come in on a Wednesday, come in on Taylor Swift Wednesday. Other than that, that's that. I play golf. I spend time with my wife. My kids are grown, but I spend time with my family, and I spend a lot of time with my granddaughter. She's 11 and going on like 21, and so we do a lot. Her and I do a lot together.
The nice thing about being a Pittsburgh guy is you don't have to worry about Taylor Swift at the ball games. Well, maybe Christmas Day
Christmas Day, yeah.
Yeah.
Which I've already been told by my granddaughter that I have to get tickets, so that just in case Taylor's at the game, even though she does not watch football, I have to take her to that game. So there's that.
Yeah. Well, Skeens is pitching for the Pirates. There's a lot of good things going on.
Exactly. I love it.
Yeah, that's great. Dr. Mancini joining us. It was a real pleasure.
Pleasure talking to you. Thank you very much.
Yeah, and we thank you for joining us. Have a great day.
Thank you.